The Distinguished Alumni Award is the highest award given by the School of Public Health. It recognizes alumni with a demonstrated record of distinguished service and achievement in a public health discipline or setting. When we select a recipient, we choose an alumnus who has not only distinguished themselves within the public health field and is a meaningful ambassador for the school, but also one that inspires future public health leaders and change makers. And on that note, tonight we honor Christine Hurley with the 2020 Distinguished Alumni Award.
Okay.
This is going to be
So I'm going to give you a little bit of background about both Chris and our moderators. You're going to hear a lot more from them about Christine's background and body of work, but I'll share a little bit with you now. Chris is a leading figure in Seattle's community health center movement and has worked with a number of organizations to reduce barriers to health care, provide safe and stable housing, as well as other social services for the elderly, the homeless, and LGBTQ communities. Chris received her master's in health administration from the School of Public Health in 1977. Through this degree program, she gained business acumen, an understanding of healthcare and delivery systems, and learned valuable skills in working with communities and coalition building. Chris shared that she was persistently interested in new things, and the MHA program was a good way to get smarter at figuring out how to be a meaningful participant in the world. One lesson that Chris carried over from the MHA program and faculty and her faculty advisor, Professor Alan Blackman, was that you need to work in partnership with communities in any planning and decision-making around their healthcare needs. This is a lesson she continues to pass on to the next generation of healthcare and public health leaders as a core faculty member in the UW School of Public Health's Community-Oriented Public Health Practice Program. Chris has served as a clinical faculty member in the MHA program since 1996 and was recognized and admired for her contributions there. Her earliest teaching role began at the UW in the late 70s with an annual lecture that she and Bob Wood gave to second-year medical students about best practices when treating LGBTQ patients. And I'll let
Homo 101.
Yeah. In 2015, the COPHP program invited her to teach the Leadership and Management course for MPH students in the spring of their second years. And she stepped in to fill the large shoes of Bill Dowling. She's also a contributing author to the COPHP's project booklet, Experiential Teaching for Public Health Practice, in addition to mentoring cohorts of students. Chris's lifetime of contributions truly reflect the school's vision of creating healthy and resilient communities and our commitments to social justice and health equity. Chris, we are honored to have you as our alumnus.
Yes, indeed.
Along with Chris tonight, we have Chris's nominators and tonight's moderators, Amy Hagopian and Jack Thompson. Amy Hagopian received her MHA in 1983 and PhD in 2003 in health services, both from the UW School of Public Health. She is the director of the UW School of Public Health Master of Public Health degree program, Community-Oriented Public Health Practice, which employs problem-based learning and focuses on social justice determinants of public health. And I should say was my first introduction to the School of Public Health as well, because I came in as an outside reviewer long time ago. Amy's wide-ranging interests are unified by the idea that the maldistribution of power undermines health. She's currently focused on mobilizing the public health profession to expand our agenda to include the prevention of war. She's active in the American Public Health, yes, thank you. She's active in the American Public Health Association's International Health Section and Peace Caucus, and is the 2018 recipient of APHA's Vic Seidel and Barry Levy Peace Award. She serves on the editorial board of the American Journal of Public Health and on the Nuclear Weapons Task Force of the Washington Physicians for Social Responsibility. And I often refer to her as my conscience. Jack Thompson received his master's in social work from the University of Washington in 1976. From 2000 to 2008, he served as the University of Washington director of the Northwest Center for Public Health Practice. Under his leadership, the Northwest Center has become a vital resource to state and local health departments in Washington and the region. Prior to his appointment in the Northwest Center, Thompson was employed by the Seattle Public Health Seattle-King County for 10 years and was director of the Seattle Health Services Division from 1986 to 1994. Before coming to the Seattle-King County Department of Public Health, Jack was executive director of Neighborhood Health Centers of Seattle, a consortium of community health centers, for 6 years. Prior to his lecturer and senior lecturer appointments, he served as a clinical instructor in the Department of Health Services for 6 years. He's currently principal lecturer emeritus and has been on the faculty since 1994. And before I hand it over to them, I just have to say, I think we're in for a treat. These are 3 fabulous people who are fun to talk to, so I'm looking forward to handing it over to them and letting them run with the evening. Please join me in celebrating Chris and welcoming Amy and Jack.
Okay, so I get to start here, and I want to say it really is wonderful that the school has recognized Chris. I mean, we all know her accomplishments, and we'll talk more about that tonight. You will talk more about them tonight. And I'm very happy that Amy and I, it was a good idea. Amy had to nominate her for the award, and I'm glad we were successful with that. This worked much better than my last nomination, by the way, which was Lyle Lovett for the Rock and Roll Hall of Fame. And that didn't go anywhere. So, okay. Anyway, okay, so back to this. So Amy and I both met Chris over 40 years ago in the community health centers. Like Amy might have met her a little bit before I did, but Chris and I were working in the community clinic system, early days of those systems. I was with Neighborhood Health Centers, you founding Pike Market Clinic. And my first question is, what led you to get involved in this movement? Both your academic preparation, your past work experience, your social justice commitment. I mean, how'd you wind up in this line of work?
Jack, I'm so glad you asked me.
I know it probably hit you cold with that, didn't I?
I did. It's a surprise. It's a ringer. Okay, well, I have actually had more than adequate time since sometime in late September to think about everything that was responsible for what I have done with my so-called career. But truthfully, I have actually thought about it. I've lined myself up against my siblings. We all grew up in the same household. We're very different. I seem to be the only person who came out of my childhood with a epigenetic change for the social justice gene. And I believe I can attribute it to, it's a curse, yeah. I can attribute it to the Sisters of St. Joseph of Newark, later known as the Sisters of St. Joseph of Peace. I went to the Immaculate Heart Academy, and I believe I actually got the biggest eyeful of change information and a sense of social justice and a clarity about the inequities of the world and what my role was supposed to be there. And I don't, my siblings do not understand what mostly I've been doing, and they don't feel that same motivation, so I give it to the nuns. They were very progressive. I learned an incredible amount from them, mostly about what I should be doing with my life and the importance of having a life with meaning, and that as a key motivator. And later, upon finishing undergraduate school in Ohio, I moved to Bellingham. I came, and in many ways, I'm a product of my times. I am a child of the late 60s and 70s. I am a person that was deeply influenced by the politics and wrongs of my time, that issues of war and anti-nuclear war activity, issues of feminism. I actually believe I'm here came to the university because of Gloria Steinem. And no kidding. And because I was involved in my youth in women's health, the women's health movement, which had its most important principle was giving control to women and people in general about their health and how to understand their own health. And that led me to understand much more about healthcare, enough to actually come to a place where I was referred from working in the Elizabeth Blackwell Women's Health Brigade in Bellingham to come to the University of Washington. And I came to the university by a referral from Nancy Field, who was an MHA graduate, an early MHA grad, and met Alan Blackman, who was my advisor in graduate school. Where is Alan? Oh, he left. This is late. Okay. But Alan was the person.
He was here.
Yes, he was here. In a suit. It was very good. Alan was a person I felt like immediately that I would learn a lot from. And honestly, some of the most important things I learned from him in terms of a real commitment and understanding that if you wanted to make change, you needed to make change only after you learn what people's problems really were from them, not your interpretation. And I think that those principles have guided me ever since. It's the way that you actually make change, and by listening to what people need and working with them to make decisions, but not bringing your own formula. It's a pretty old message, but it's really a big piece. Honestly, I think I'm also here because I learned along the way that a commitment to social justice led you toward a commitment to service. And for me, I learned pretty fast about how, I get a little choked up, how much joy there is in service. At Bailey-Boushay House, many years later, I met this incredible woman, Ganga Stone. She was getting an award, and she was in Seattle. She came to Bailey-Boushay to learn about it. She was the founder of an organization called God's Love We Deliver, an early AIDS food delivery service in New York City. Ganga had these little buttons that said, "Service is joy." I thought it was I said, damn, she's right. The truth is, I mean, I still have a little handful of these, but I've given a lot of them away because it is the piece, I think, that keeps people going, that work in places that many people go, oh, I can't imagine. I mean, how many people in my life have said, I could never work at a place like X? And honestly, I felt like I had a secret that said, oh, you just have no idea. It's actually quite amazing that your access to joy and intensity offsets a lot of other things that are that sort of can bring you down. But the joy that comes of that service from working with people like Joe Martin and Les Piddle and Tom Heller at the Pike Market Clinic, and it goes on. These are all my friends, mostly. If you don't know most of the people in the room, I'm surprised you're here. But anyway, I'm a product of my time. I'm a product of those who educated me.
So you want me to ask another question?
I think so.
Okay.
Just give me something else to talk about.
Well,
Yeah.
so a big part of what you excelled in, and still excel in, is the whole notion of collaboration, working with folks, negotiations, and then the clinics. That meant with the patients, with communities, with our boards, with other providers, and in the market, you had a whole additional layer on top of that with the other vendors and the other folks in the market, and you've been very good at that. I was saying to Dorothy Teeter, there was an old organizing cliche that says, you gain power by giving it away, and I think you exemplify that big time for me. I mean, it's just been remarkable, your ability to work with folks in many different settings in many different parts of the community. So tell me a little bit more about that, because you take that from the clinics, and I've seen it through all of your work. So talk a little bit more about that, or anything else you want to.
Well, Jack, I'm so glad you asked me that question. I've thought about it a lot, and it was sort of like giving somebody a guide to how to interpret. You know, you're really trying to stand back. I did not have a plan for my career, and to actually stand at the other end of an arc of work, you say, exactly how did I get here? But your theme of collaboration, as I had to reflect for tonight, the theme of collaboration is a piece of my DNA, but I'm also, I have to say that a big piece that has been consistent for me is an attraction to the tributaries of health and community health. Grace Paley, an activist and artist, famously said, the mainstream is wide, shallow, and slow-moving. The tributaries are where all the fun is. And when I heard that quote, I'm like, she must have known. I mean, she did. Actually, I've been much happier in my work where I had room for innovation and response, real response to what you see in front of you instead of the inherited wealth of other people's experience. And that has been an important theme for me. I'm quite mission dependent. Some people say mission driven. I have noticed that I can't even get out of bed without a mission. And I call that a dependency problem. And I really like having a context of large ideas and motivations for getting me to clean the floors at Bailey-Boushay, because those things are necessary to be done. And I like a full range of motion in my work, to be able to have access to political lobbying and direct patient contact. So, and honestly, the other major theme of my life has been a consistency of people that I have followed, and they have followed me in my work. I said at the reception earlier, and I should say it again if you did not hear it, I am definitely a product of nepotism. I look at everything I've done, and it's either people who were my mentors or my classmates or my colleagues who hired me again and again.
Nepotism.
I don't know, it sounds like it should be.
Networking.
Otherwise now. Yeah, networking. I didn't exactly know. Networking. I always thought it somehow seemed bad. People were good enough in my life to take chances on me consistently, and I have never taken a job that I knew how to do, which is really sort of freaking amazing. But good work if you can get it. So I have had that opportunity. The market was totally a collaborative effort, and the city of Seattle started the saving of the market in a vote to save it in '71. So I walked into a community that was an incredibly intensive, focused, and also in the process of renovating itself. But I came upon a stream of energy that was working toward preserving the community as well as building the commerce back of the market. And preserving the community meant providing services, restoring housing for people, and other things like that. But the work and the collaboration that came to the clinic were really incredible things, to see how the health department was a major partner, as well as the Market Development Authority, and that soon it was residents who were talking about what was needed at the clinic, and what became a senior center and a food bank and a child care center. And soon those organizations were building our own network of support in the Pike Place Market Foundation. Those were amazing times, and the network of community health centers was part of the way that I learned anything, because we were a close, connected group. And when I look back at the things I really learned about health, I learned about how many more things were important besides health services. From people like Joe Martin, I learned just how much a life can fall apart if you don't have a house, if you don't have a home. And the first formal act of the Pike Market Clinic in 1978 was to sue the city of Seattle for destruction of low-income housing as part of urban renewal. And I think it makes me very proud to remember that that's the first thing that we chose to do, to actually meet hotel owners before you have a clinic. We opened in an old tavern, part-time senior center, part-time clinic in the old Mother Lode Tavern. That's actually how I met Amy Hagopian. She came to volunteer when we were scrubbing the floors and converting the Mother Lode into an esteemed, distinguished care center, a clinical establishment. But that kind of connectivity is part of what makes it work, and it still is really the only way you get stuff done. To show you the continuing stream, I just want to name a few people that were continuing parts of my life. In school, I met Jane Krigler and Fern Schnitzer. They became advisors to me, mentors. I was referred to them by Dave Lawrence, who was a faculty member at the time and went on to run Kaiser. Mark Secord I met because of a connection for bringing residents to the Pike Market Clinic. Austin Ross, also at Virginia Mason. I met the love of my life in Betsy Lieberman, who came to work with me at Pike because I definitely did not know how to keep track of money. But Betsy and Amy and Jack are continuing people in my life in terms of the collegial and supportive relationships that have been much part of it. I left the Market Clinic in 1983, and at the end of the time my time at the clinic, the first brush of AIDS came to the clinic, and it was my first experience with it, and I felt like it entered my life as a part of the most important piece of my clinical life. I went to work. I thought actually by then I was ready to learn in a larger organization. I didn't know where to go. I thought about the values that major organizations had, major healthcare organizations, and decided that group health was the only place that I could work, mostly because of the synchrony I could find with the values and principles that guided group health as a cooperative. And I spent 8 years at group health, learning a whole lot of things, and was given a terrific amount of opportunities. It was a good values match in many ways, but it was less meaningful to me in terms of my role. It never seemed as clear to me. My motivation was lower. I could never quite feel like I was a essential element there, but it really taught me so much. In fact, I thought I knew more than when I left when I left group health than I really did. That was dangerous. Again, I was hired at Group Health by Jane Krigler, again, my mentor, and Alan Blackman, who was also working there. I was given work by Cheryl Scott, my classmate, and by Richard Marks, my other classmate, and also members of my family. And it was I looked in that period to find a way to actually participate more in the world of AIDS, and have found a place to actually do something while the organization figured out what it was going to do as an employer of people with AIDS, as a provider of care for people with AIDS, and as an insurer of people with HIV and AIDS. And that it led me to be more clear in my own life that if I could ever find a job in AIDS that I could do, I would do it. And you have to watch out what you wish for, because I did. I found a job at Bailey-Boushay. And for those of you who do not know what Bailey-Boushay House is, it was the first newly designed facility for people with AIDS. It was built by the community as a result of a long-term planning process, a short-term planning process conducted by the health department and Jane Krigler's design, and Betsy Lieberman actually did the planning for looking at long-term care needs for people with AIDS. And that planning made all the difference. Seattle and King County were blessed by the foresight of the public health department in partnership with so many players in the community to actually think about how to develop systems of care and prevention for people with AIDS and those who are at risk. The continuum of care is unique within the country. It was so far ahead of many other communities. The planning for what became Bailey-Boushay as a long-term care facility for people with AIDS was a jewel in the crown of that continuum, and it really was a masterpiece of work. It saved so much, it required so much collaboration, so much sacrifice by many people to work together, but it made a terrific difference and continues to make a difference in our response to AIDS. There were many unlikely partners in the development of Bailey-Boushay. It was a planning effort that was started by the health department, joined by people with AIDS and activists and providers and hospitals and insurers and the Department of Social and Health Services and neighbors around the facility that became part of our community, and even people like the lobbyist from Boeing. It took a lot of effort to make it happen.
It's a Seattle thing.
It was a Seattle thing. people would ask me later, how can we make something like this in our community? And I really felt like saying, oh my God, you had to align the stars, the moon, and the sun to make this happen. It is definitely a product of what Seattle is like. This is sort of my way of remembering that part of what I'm supposed to tell you about is how much value, how important the School of Public Health is to the incredibly progressive community of health in this area, in our region. That the School of Public Health and the sort of porous walls of the university, connecting with a health department with an incredible history of progressive and aggressive care and response, and an activist community for health, really made this community different. And it is the connection of all three parts, the porous nature. I mean, how many people from the university's School of Public Health or the medical school were on the boards of every community health center that were part of the whole process of building systems and approaches. Both the community health centers and the service world of AIDS are all connected, all wrapped up with the School of Public Health and Harborview and the health department and the community. And that's really in many ways why you could stay in this community for your entire career and not run out of things to do. There was always important things. The fun things about Bailey Bechet, people don't usually say it's fun, but the truth is fun. I mean, there are opportunities for exposure to incredible parts of people's lives is an incredible privilege. It's also professionally, it's a chance to do things that really tailor services for people that don't exist and that really can meet them where they are. You can actually try to build a facility that's based on acceptance of people when they're not, and really is built with incredible measures of attention to what you can do to help and make lives better. Bailey-Boushay was also the most incredibly dynamic place I have ever worked, for good and for bad. Things changed so fast, it was breathtaking. My late colleague, Jean Crost, once said, it's like bumper cars. The building wasn't even open before treatment models had changed and the rooms that had been designed specially for the place were outmoded. And that just was the beginning. I mean, we opened the place after binding arbitration with the Department of Social and Health Services on how much money they would pay and what staffing was necessary. It was a roller coaster of fun. And
required an incredible leader.
Incredibly durable person. But it also required incredible people. One of the happiest things that ever happened for me at Bailey Bechet is the person I recruited when he was in his 20s, Brian Knowles, to come and run the adult day health program, which was, in fact, far bigger than the residential program. There are 300 people connected to the day health program too, helping people remain independent. The happiest things I ever learned about what people with AIDS really need came from him. He is an incredible leader still, and I left Bailey-Boushay and gave it to him, and he took it. It was really good. But I left Bailey-Boushay in 2004, and I was really ready to go, and he was really ready to take off, and it was a wonderful thing. But the number of people who give so much to make that place happen every day, and the changes of the needs of the people both with AIDS and other complex nursing needs requires super people today, and it's a lucky place to be.
He's looking at me.
So could I, just two comments. One is just for the larger audience. When we were setting this thing up, we were talking about the connection of the school with the community, and we both said, and I certainly said, there were probably 7 or 8 colleagues I worked with in the community clinics or the health department who later became colleagues on the faculty. They were faculty at UW, but I first knew them in a community role, and that was really important. I really was impressive about the school, and I think sometimes that's understated. The other thing that's understated is in the course of all this and your organizing abilities is what a good manager you were. And you really could get things done in a very tough setting administratively. I mean, I came from a community organizing background, and I was okay at politics, but I was a terrible manager. I always had to hire somebody who could actually do stuff. But you were always really good at that, and I was always in awe of that, how good you were at actually getting things done. So you would.
God, you just have to hire good people, but even that
You
is
were
a
the good
challenge.
person. I'd hire you in a minute. You were the good
So
person.
anyway, just to continue my thread, the thread of my people who have brought me everything. Jane Krigler built the continuum of services. Betsy did the planning for Bailey-Boushay. Mark Secord and Mike Rona, a classmate of mine, and Austin Ross and Virginia Mason hired me to run Bailey-Boushay. Another one of the, what were they thinking? I had no idea what I was doing. But in fact, I do want to also say that the unlikely partner at the end of my list really is Virginia Mason, the organization that actually stepped up and said, we'll do this, we'll run this place. They had really no HIV practice. They had no long-term care experience, and they said yes. And it was a miracle because nobody else would do it. And you needed somebody. I mean, Betsy's running AIDS Housing of Washington, building the facility. She's got a facility down there in Madison Valley, and no one to run it. And Virginia Mason, as a partner, has been the most important partner that Bailey-Boushay could have. They are the safety net for that organization, the supporter, and also not a demanding limelight hogger about what Virginia Mason does for Bailey-Boushay and for people with AIDS. Okay, what else have I done?
Oh, maybe I'll ask you something.
Okay,
Is that,
I think I have something else to say.
oh, that's great.
Yes, yes. Yeah, I have to turn the page. Yeah, moving on from the Sisters of St. Joseph. Thank right. Yeah, right. Okay, so I left Bailey-Boushay because I actually had come to the end of my patience in dealing with the delivery system.
Oh, I don't know what you're talking about.
I don't know what you're talking about. Sometimes I've looked at my career thinking I have spent my entire life trying to get billing codes for services that don't have billing codes because they're off the normal menu of health care. Foot care, couldn't get that one done. I mean, small things, housing. I mean, you should be able to invoice for getting someone housed. It's the most important healthcare move you can make for someone. But I did sort of come to the end thinking you shouldn't have to work so hard to make something that's good possible, that's right possible. I mean, Bailey-Boushay was loved by Democrats and Republicans. I mean, it was a miracle product. But you still had to spend a lot of time in the delivery system trying to make it work for people who didn't fit in the package. I then decided it was okay to do something else. I actually discovered you could have a job for less than like a prison term. I mean, I liked my work, but it did feel like I needed to stay for a long time to make things happen. I actually got a job on Whidbey Island with a community development organization called Goosefoot. Yay, Goosefoot!
Oh, they have
These
a
people have
cheering
crossed
club
waters for this. Anyway, it was in many ways a more remarkably bizarre thing for me to do than I could have ever believed. Goosefoot was a community development organization founded with one philanthropist, incredibly generous gift that was made to restore old properties, commercial properties in a rural setting, to actually inspire the redevelopment, to encourage the community to connect and stay together, and to take the eventual profits, and reinvest them into community need for lending, for services that the community need, and things that really support the community's connectivity. It was a cool place to work. It was also another thing I knew nothing about because Goosefoot had borrowed some more money at the end to buy an old, honestly crappy shopping center, and with one really crappy grocer as the anchor tenant. And the grocer was leaving, and I spent about 2 years looking for a grocer partner. This was a new piece of business for me. Yeah, I met with a developer once a month at least, looking for someone who would partner up with us. Eventually, we found a grocer who would, but actually he had grown up in that community. He had worked in the building as a kid. His father owned the grocery store and sold it. But in the end, Goosefoot owns a grocery store. I honestly signed the contract for the Bimbo bread. Do you know what Bimbo bread is? Wonder Bread. I signed the Wonder Bread with my own checking account. But opening a grocery store is really pretty damn exciting. We designed Goosefoot owns the grocery store to this day. The goose has definitely laid her golden egg. The Goose Community Grocer was designed to be held by Goosefoot as an organization run by the Myers family and operated by the Myers family, but the profits go back to the community. And next year, in 2020, I think we're going to hit the $1 million mark of giving money back to community building, which is a miracle. And it is in many ways the funnest part of doing work. I mean, strangely, I find building things that are going to give money back and build resources and strength, whether it's the Pike Market Clinic, which has given, and the Pike Market Foundation, run by the beloved Miss Morales for many years. Whether that, I mean, the Market Foundation, which was formed as a little unifying way to raise money collectively by the clinic and the senior center and the food bank and the child care center, has raised $32 million for those services. And that's a powerful thing. Mm-hmm. So that's a fun thing. So anyway. Respite. Oh yeah. I've actually done a few other things, but the list gets a little long. So medical respite. I worked on medical respite, right, which was a fabulous thing for people who are homeless who are coming out of the hospital, and did a few other things. But yeah. And I got recruited by Amy.
You did.
Back again to my line of connectivity.
Yeah.
Back to work.
So when Bill Dowling retires, who are you going to hire?
Oh, yeah.
So, I was running the community-oriented public health practice MPH degree program, which I took over from Peter House, who took over from Bud, who is sitting there, Bud Nicola, who took over from Fred, who is not here, right? Okay. So that was great. You took over our management and leadership class, which students take at the end of their second year to prepare them for entering the world, and who better to teach that class than you. I also now teach a war and health class, which I recruited you to talk in because you're doing some new interesting work on Whidbey Island. So you want to talk about that for a minute?
Why, yes, I would, Amy. Actually, I could tell you about other things I do too. Besides, I'm a casually employed person.
I will give you as much rope as you
Good.
want.
What's our time? Okay, yeah, we have time.
We're good.
I'm a casually employed person, and I work very happily as a faculty member in the community-oriented public health practice. The graduate program I probably should have gone to, but the truth is MHA was very heavily, it didn't exist then, but it's a pretty good match for who I am in terms of really developing public health skills for practitioners to work within communities and to really be most effective in working with groups of individuals and looking at things from a broader perspective based in the community. It's a great match for me, and I am happy about my relationships. I particularly love working with my colleagues, the faculty colleagues who actually stay. The students are rude enough to actually leave after 2 years and go on and do great things, but I really have grown immensely from that work. I actually think that I'm a vastly smarter person, and I don't mean about management and leadership, I just mean that I've learned a lot about myself, and I think I've learned a lot more about issues that are really deeply important to me. I mean, I don't think I would be nearly as aware of the world around me, particularly on issues of racism, as I would be if I had not been immersed in the School of Public Health and particularly COPHP. It's made a big difference in how I see things and how I want to be in the world, and changed my view of a lot of things. I also spent a lot of time working as a longtime volunteer, a 20-year volunteer, board member at the Burke Museum of Natural History and Culture. Yes, yes. We're very proud of the new museum on the north
How
end
many
of
have
the
seen
campus.
the new building?
Don't miss the T-Rex in the top window, you know. But in fact, there, for me, some of the most meaningful things have to do with the relationship of the Burke to indigenous communities and the relationship of the collections and the meaning that is gathered and the ties that are made between that institution and a continuing growth of understanding how the role of a decolonizing museum to really to bring back the connection of tribes to their own properties, to let them speak and tell us how to hear what they say, what these mean. I spend a lot of time birding, biking, and I also spend a lot of time up on Whidbey. To answer your question, I do spend a lot of time. We're going to link back. Amy's been recruiting me to make the only lecture of every year. I speak about the Navy and public health in Puget Sound. Marlis and I spent a lot of time on Whidbey, and it's hard to miss the impact of the expansion of the Navies in North Puget Sound. The Growler jet program, the Growler jets, loudest jets in the world. All of the Growler jets owned by the United States are based on Whidbey Island, and they're flying.
What's a Growler?
A Growler is an E-18 Boeing jet.
Beer.
What? No, it's not. It could be a Growler. You need one to sleep when they fly, but they fly all the time. So it's a great opportunity to look at it as a public health issue. Actually, the Board of Health in Island County declared that noise was not a public health issue, which really got a few attentions from our community. Had to sue the board had to sue the board, go to the state board of health, said, oh yes, noise is a public health issue, but actually it's not just noise. It is really about every aspect of life that is disrupted by the growlers.
The wells.
The wells, thank you, Amy, thank you. Yes, wells. The Navy's firefighting foam has poisoned the town wells for Coopville and poisoned many private wells all through central Whidbey. And the noise affects animals and whales and people. And there's lots of other things, but it's a great public health thing to really get your teeth on it. If you really want a quixotic assignment in life, try fighting the military-industrial complex. Well, go for it. I will. It is definitely the most challenging, pain in the ass partner you can. I mean, they're definitely like AT&T used to be. You know, they don't care, they don't have to, they make the rules. But we got the Attorney General of the state of Washington to sue the Navy, as well as a bunch of other people in Whidbey. So it's a long battle, but you know, these are the things that keep you awake.
Okay. So do I get to ask my last question now?
I think so.
Okay.
Yeah, you do.
So you came to get your MHA in 1977, graduated in 79, which was when I met you scrubbing floors at the Motherlode. And you had an amazing career in the interim. And then you came back 7 years ago to start teaching in the school that had birthed you. And I wonder what you observe about students now, how they're different, how the challenges they face are different, and what you sort of think about those differences and the implications of that, and how the school has changed in response.
Wow, that's a simple question, but I'm so glad you asked me.
Yes. Well,
the first thing to notice, honestly, is that students come. I read admission files. I read them and I think, how did I get into graduate school? I mean,
I could never compete with this.
right.
I know.
The students come with such a boatload of incredible knowledge. I mean, some of them have undergraduate degrees in public health. I didn't even know what public health was when I graduated with a degree in political theory in my undergraduate years. But journalism, yeah. How about you, Jack?
English major.
Yeah. Okay. Public health, right? You can make a public health person out of almost any raw material. Students come with an incredible package of experiences and knowledge about public health. They really get it a lot more than I could say for myself. And they also come with another thing I really have noticed is that students, somebody told them to say this, but they all have passions. I always thought about myself, I could describe an abiding interest, a keen interest, passion is really big. But students have a lot of passions, and they tell you about them. And that's pretty wonderful, because the truth is, you have to have people who are nutcases to do this work. You have to have ambition. And you shouldn't know that you can't do things either, because that just holds you back. Never believe them. Well, besides that, the field of community health is so much more populated. I felt like I was alone in the wilderness with a few colleagues. I mean, I see Rogelio up there, who is now a regent of the University of Washington. As a classmate, Rogelio and I had a common interest in community health, but it was pretty unpopular. I mean, there really wasn't a lot of other people in the MHA world when I graduated. Master of Health Administration and Services, in case you didn't know about that part. But there weren't very many people who were interested in that. It was pretty lonely. And the world is filled now. The field is filled. And many of the players are the great graduates of the University of Washington. I see a couple of my beloved students in the audience. They're doing really good work, and it's exciting. Unfortunately, I lost the list. I have 2 pages here, but they're both the same.
How did Miss Marlis allow that to her?
I don't know. My assistant, Christine, is always on probation.
Mr. Daytime.
Yeah, I just discovered this. I was turning the page over and thinking, I think I already did that.
So you have to draw on your memory.
Yeah. No, there are some other things that are important.
One thing they face is a very different tuition bill.
No, you don't tell me that part. I know that part. That's at the end.
Yeah.
I know what the other thing that students often know before they get to school, and they certainly know a lot more when they leave. But it really is that the definition that we use to describe a healthy community and those things that make a healthy community is so vastly different. Honestly, I got an MHA, Health Administration and Planning, in services. The world of health was so oriented toward thinking about if you had access, you would be healthy.
Right.
And clearly, that's not true. Look at this country. So that broadening definition that the health department and the School of Public Health has really recrafted to include all the things that make it or break it for people's health. Everything from the institutions we have to the basic relationships to the inherent importance of racism as a determinant of the winners and losers in our society. Those things are the things that you see that are so different than how we started. And while it was clear to me pretty quickly that things like housing made an incredible difference, the elaboration of the definition of health and the determinants of health.
The economic and political.
The economic and political and educational, institutional, right.
Yeah. There are people who talk about that.
Yeah, there are people who talk about income inequality all the time. All those aspects of life are now understood to be the things that determine whether you live till you're 80 in good health, or you die when you're 45 when you're homeless. So that's a big change. And you're right. The other thing that is really different in the environment is I came to school to graduate school as a child of privilege. I came, privilege that was unearned, absolutely unearned. I had no debt from my undergraduate degree. I got a public health service fellowship. It paid my tuition. It gave me a livable stipend of $200 a month. I left graduate school in better financial shape than I entered graduate school. Now, is that embarrassing? It's like, saying you raped and pillaged the earth, and now it's like it's embarrassing legacy in some ways. When I look at what students come with today, students enter the University of Washington, most of them without a financial net, with a very deep hole to dig themselves out of, and that is really different.
Yeah.
The university does not have the resources. The public does not devote the resources to training the future leaders that we need.
But we have to invest in the growlers.
Well, we do have to invest in the growlers, but that's yeah. So I could, it's really hard for me to. We have more time to talk. That's really done a good job in keeping this shorter than I thought. That's good. We have. I will elaborate. I'm come from a tradition of the Catholic Church, which I didn't give a lot of credit to for much in terms of forming me, honestly, except for those Sisters of St. Joseph of Peace. But I did learn early that you could never pass up a crowd. Whenever the rule is, whenever two of you are gathered in my name, take up a collection. Well, that's my belief system, and it's this is either a version of This Is Your Life, or it's a fundraiser for me. It's not my memorial, so we could make it a fundraiser. The truth is, I would like to talk about one more thing that I really feel strongly about.
Do these people get to ask?
Then you can ask me some questions,
Okay.
right? Honestly, I think that one thing that is so painfully obvious to me as a faculty member that I just didn't get a clue about before I came back to the university is the barriers that we create for students. My tuition was $6,000 and was totally paid by the U.S. Public Health Service Fellowship. Tuition for a student coming into the community-oriented public health practice, that's certainly going to be a high-flying income group when they graduate.
Yeah.
Student tuition now is $60,000. Plus, you have to live in Seattle, which will pretty much add another $30 minimum to your budget. They will leave with a staggering debt. And I have actually done the math and figured out that an entering class into COPHP of 27 students pays $1.6 million in tuition, the full cost of their education, no subsidies. And what we have in the program to help bring students in is $14,000 a year for scholarships. I will tell you that the School of Public Health and the Department of Health Services and the Community-Oriented Public Health Practice program, we are hell-bent on building the future leaders that will help us resolve and meet the challenges of our world. You can't do that with only a bunch of white people with resources. You must bring other people. And it's just not going to work. We need every heart and mind at the table. We need every background. We need every diverse experience to bring to bear on dealing with issues that are too complex. That if you're just a person of privilege, you never will understand the issues that challenge our communities. And we will not be able to build that cadre of leadership without more help for students. And so, it's early in the evening. You can go home after this, after you ask more questions, but I really would like to give you an opportunity to join Marlis and I in making a personally meaningful gift to the Department of Health Services H-Seed Fund, which stands for Health Services, Excellence, Equity, and Distinction.
That's what it's
Yes, I remembered the name of it. But
have that written
HSEED is
down.
our fund for actually having a small bit of money to give the students. Literally, it costs $10,000 a quarter to go to school. $10,000. We have 14. We got 1.4 quarters worth of subsidy for 27 people. We don't have enough. We really need more. And honestly, if we want to build the future of public health leaders, we need more help. So, you're right. This is a fundraiser.
Those Catholics.
That's right.
Okay.
And so you'll get an opportunity to find an envelope outside. But in the meantime, we can open it up for questions.
Monet has a microphone, and she knows how to use it.
Hello, yes. Peter.
Thanks, Chris. It's been great. And as you know, my question's about governance.
You
What's that?
say your name.
Oh,
We're
I'm
going to
Peter
have
House.
everybody say their name.
I'm Peter House. I was a math major before I went to public health school. Okay. So my question's about governance, and in your travels, you've told us you've been an executive director and a staffer, and you've also been on governing boards, and we know the issues around that. Locally, Boeing, who's been mentioned already 3 times, they're struggling mightily with governance right now. This university struggles with it from time to time, and certainly all small non-for-profits do. So I wondered if you would share some insights about that balance between governance and the management team, and who's in charge and who should be making the big decisions. But if you'd just share some insights,
Did you know
please.
Peter is the chair of a board?
I do. He writes me questions once in a while.
Do you know what board it is?
Yes, it's the Roots Board. The Roots Board, which is a youth services organization in the university district. And
For
thank you very
homeless
much
youth.
for homeless youth. All right. That's, as I said, school public health folks are very busy in their community life. And Peter is a great example. So, well, this seems like we have this in a governance case, right, at the
Yes,
end,
this
right?
is- yeah,
Yes,
the
in my
governance
class. So the question is about governance and the role of boards and leaders who are employed by boards. And, you know, the problem is boards are underestimated and they have incredible responsibilities, and I think are underestimated. Often people don't even get the fact that their job is to assure the mission of an organization. It's really big. Occasionally you have to do unpleasant things. But the board is really in charge, sort of. The board hires people to run an organization and meet their goals as an organization, and there is always a partnership. And if there isn't a partnership, you're really usually in trouble. It is surprising to me how many people I have known in my life who have actually gotten sideways with boards and been canned because they didn't quite get what their job was. Their job is to inform the board, tee up the board, alert the board, help steer the board, not be the board. But really, you have to be working really close with the board, because otherwise you're not doing a good job for the board or for yourself or for the organization. It's tricky, but it's not that complicated. Okay. Oh, look, there's another question. Okay.
Say your name.
I'm Elizabeth Coppinger. I'm on the board of the Pike Place Market Foundation.
Yes.
So my question's about, well, I have 2 questions. The second one you don't have to answer if you don't have a perspective on it. But one of the things that really impressed me, kind of reading about the formation of the clinic at the market, was that when you started, you just used the bathroom for the tavern as your lab,
Right.
because it had water.
A urinal has a lot of uses.
Yeah. And so that really stuck with me and impressed me a great deal. So 2 things. One is that it used to be a lot easier to be poor in Seattle.
Yeah.
Seattle in the 70s was not a thriving city at all. Today, it's a very thriving city. And two things that concern me. One is that we're almost a richer city, but less willing to help people in need. And it may be just that fewer people have been that close to need as there were back in the 70s. I wonder your perspective as a teacher with students today. You know, you never waited for what you needed, you just used what you had. And you talked about the passion that students have today. Do you think they still have that kind of just take what you got and make it work kind of feeling that you had to have when you were a poor city and just starting a health clinic?
I don't always know that I know that answer. I think that Seattle was a very more malleable environment in the 70s, that you could make things happen a lot more easily, and that things didn't always have to be tidy. I, like many of my colleagues who left school, well, some of them anyway, I was employed by the CETA. CETA, Comprehensive
Who here
Employment.
was ever employed by
Employment.
CETA?
Yeah, CETA, Comprehensive Employment Training Act. We all became grantees
Jimmy
upon
Carter.
leaving. Yeah, $833 a month, $10,000 a year was your salary. It was great. It was employed so many people in the community in terms of human services development. And it allowed me to I worked for the city of Seattle for a long time, informally, sort of, while actually being delegated to, explore things in the Pike Place Market in terms of human service development. That degree of flexibility, I think less of it exists, which means it's harder to, blend the lines over and do things that are outside of the edge of a job in a department, in a service area. And I was really lucky to get that opportunity. And I am a scrappy person. I mean, Betsy Lieberman and I drove around downtown in a truck going to doctors' offices getting contributions on old exam tables. And that's how the Pike Market Clinic opened. But you could do that then. And I think in places not like Seattle, you can still do it. I think Seattle is much more divided in many ways. Poor people have much harder struggles. The average income of the person who lives today in the Pike Place Market is $600 a month, believe it or not. But that they can exist in the market because we've built a community of services around them. But most communities don't have that level of, planning around it and attention to that level of a community building. So I think it's harder. I think it's harder for students too.
One of the apocryphal stories about you is that you got downtown Seattle declared a health underserved area.
I did. I did. The community health centers in Seattle were the first to convince the feds that you could have health manpower shortage areas in urban areas. The National Health Service Corps was created in the 70s, but primarily focused on rural communities that had no access to care. And my colleagues, my beloved colleagues in the community clinics, convinced Warren Magnuson to change the rules to allow the National Health Service Corps to bring docs to urban areas, and Seattle was the first place. The Pike was a sort of a second wave clinic forming in the later 70s, and so I'm listening to people in the market telling me, older people primarily, saying, I have Medicare and I have Medicaid and I can't find a doctor. People will not accept me. And that was the continuing
I'm sure glad
theme.
that's changed.
Sure, that's changed. So I actually started the usual seat of the pants MHA graduate. I can do a study, and then calling people, calling receptionists at the end of the day to ask them, secret shopper, asking them whether they could accept people with Medicare and Medicaid, and the answers were overwhelmingly no. No wonder they had trouble. And so I actually drew the map of downtown Seattle, and then I edged up First Hill and drew a line around First Hill and started calling there. And damn if the answers weren't the same. I actually got First Hill and downtown Seattle declared a health manpower shortage area. It was hilarious. I mean, the King County Medical Association came to the Motherlode Tavern for a meeting. It was incredible. Yes, you could actually get stuff like that done.
And by trying to figure out who would serve whom, we actually got the census tract, including the medical dental building.
Right.
Was included as an underserved
Yeah,
area,
right.
which was true, it was.
Yeah, they didn't, they really, so you can do things like that. I think it's harder, and it's also, you probably would have had to have an IRB to do the study, and I wouldn't know how to do that. Only students know how to do
Finding a lot
this.
of creative ways.
Yes.
Right, students can do that, but they actually know more than I do.
Who else has a question? This person in the middle. See if Monet can get all the way over there. And tell us your name.
Hi, my name is Lisa, and I'm going to just admit that when you started describing the tuition burden for this current generation of
Weeping.
graduate students, I started feeling waves of anxiety because I'm a graduate student right now. I was kind of, I think, still in a bit of a state of denial, but I guess this is a bit of like creative mental gymnastics, but I was curious if I tied together this question about the board and governance, and maybe I didn't completely understand it, but the board and governance and this idea of philanthropy or donation and giving, given the limited amount of funds that you have for incoming classes of graduate students for community-based practice and public health. Is there a way that we can be creative about those donations? Because, Helen, I was really curious about this CEDA program that you were describing. And so is there a way that funds that could be raised locally could be integrated into a creative program where incoming classes, if they could access those funds, somehow building in like almost like a debt forgiveness concept, if it means you are immediately joining a kind of like a service collective that's working locally. I don't know if that makes sense, but just
that is
kind of
National
tying
Health
it
Service
back.
model.
Yeah, and there is supposedly a public service debt release program that the federal government
Betsy
makes very
DeVos is
difficult.
on it.
Yeah, Betsy DeVos, our Secretary of Education, is on that job of
working
making it
that hard.
really hard for people to qualify for debt forgiveness for 10 years of public service.
I think it's a 90% denial rate.
Well, that's a very, yeah, well,
Not kidding.
I think your question is great. And points out that many of the resources that existed earlier do not exist for students to be a safety net for students. How we use money that we can bring into the programs is a question that's, I hate to say it, above my pay grade. But it is within the realm of decisions within programs, within the school, public health, how we build a more robust net for students, and how we build connections into the community that make that transition easier. If employers actually paid part of their debt, that would be a great thing. It happens now in larger corporations, but it certainly doesn't happen in public service. But we do desperately need ways to support the development of leaders.
Okay,
There was someone there, yeah.
there's another question. Okay, while you're walking over there.
So,
Jean
when
who?
people go to jobs,
You have to tell us who
Jean
you are.
Singer.
Yeah.
People
Whidbey
go to
Island.
jobs, typically they have a skill set, and that matches the job that they're going in for, most times. In your history, you have not necessarily fit the job description. So what I'd like you to speak to is what are the qualities that enabled you, and I'm speaking particularly to the graduate students who are in the room who might be taking your classes and others who might be transitioning to other work. What are the skill sets that enable you to walk into a situation you know nothing about
This is good.
and be successful and actually put that organization way into the future?
Other than chutzpah.
I am very good at asking people for help. I'm really good at asking for people for help. And then I'm also really good at paying attention to what they say. And that's really helpful. I have a good sense of humor, not an outlandish ego. I'm not afraid to humble myself in the process of learning. I sort of like it. Betsy Lieberman and I had a little secret phrase for our approach to life, which was, we described as, no offense to anyone when I say this, but friendly but stupid. It's very winning to actually ask people for help. It gets them involved in your problem. They help you.
How do you decide who to ask for help? Because it matters.
Yeah, well, you have to actually ask more people than you may get.
Right. That's a good answer.
But a no is never, there are a lot of worse things. It's the same as like fundraising, which I do recommend as a skill for everyone to learn, because otherwise you can't do a lot of things. But I have become a good fundraiser. I'm a really good asker for help. I really like building relationships, and I think if you get a job that you don't know how to do, it's also very freeing. Not bound by, the wisdom of the field to hold you back. You can make a lot of more mistakes, and then you can be more forgiving of yourself because you didn't know. You should speak in declarative sentences. People think you might know what you're doing.
Another answer that Chris didn't give, but I think is exemplified by what she's done, is sort of an eyes on the prize, and to know what ultimately you want to achieve as far as society goes and how any particular work situation gets you toward that goal, because you've been good at that.
And to have a unifying theory, right?
Theory of change. I don't really know what that phrase means yet.
Sounds good,
but it's
though.
very,
It's good.
very popular in the
Sounds
academic
good.
world.
Yep.
I should have a theory of change. You should have a theory of change, a theory of how everything is held together and how you can leverage yourself.
Right.
I mean, that's really the most important thing of coming out of graduate school, is that you actually have a ticket that gets you in the door to do certain things. Mm-hmm. And then you also have a network of friends that are going to help you, if you're wise, going to help you all your life. And you're going to build that network in a common circle of service and mission. And it's pretty easy after that, but stay connected. I think actually I'm a pretty old-fashioned about staying close to home, that I feel like my community, I have never thought for 1 minute about taking a job anyplace else. It just made no sense to me that this is a community that has so much capacity for innovation and caring that it never seemed like a place that you would ever want to leave for that reason.
Good. That's what I thought. That's good.
Yeah. Agree with that.
We'll do one more.
Anybody else? Oh, great.
Summarize.
Oh, you just triggered a question there. You never would think.
Tell us your name.
Tell us your
You're
name.
good.
Tell
You're
us your
good.
name.
Is it on?
Yep,
Ellen
it's on.
Ferguson? Yep. Old friend, greetings. You just said you'd never think of taking a job anywhere else, except you didn't mention that you and Marlis took a job halfway around the world in India.
True.
Why don't you just share a couple of minutes on the extraordinary work you were doing there?
Well, I did leave that off my resume because it was sort of another one of those things where there was a time in my life after I left Bailey-Boushay, then when I decided I would like to work on global health. I would like to become a global health practitioner. Of course, I had hardly been out of town, but I was involved in the Women's Health Brigade, and I hadn't been to the gynecologist yet, So I'm able to project pretty far beyond my own experiences. Marlis and I many years ago traveled in Asia. In 1983, we were sitting on the Kowloon side in Hong Kong and said, man, this is such a cool place. Let's try to figure out how we can live someplace else and work someplace else. And it took Marlis, honestly, it took Marlis a really long time to leave her job at the Pike Market Foundation. So 30 years later, zipping right toward the prize of our objective, we decided we would find an assignment and do it for at least a year. And we got a volunteer gig to work on a Gates-funded National Indian HIV prevention program called Avahan. And we went to India and lived in Hyderabad for a year. It was one of the most amazing experiences we ever had. We spent the whole year working with groups of sex workers in the 6 states of the highest rates of infection. And our job, as we designed it, ended up helping communities figure out how to raise money themselves. Mostly convince them that they could raise money themselves, because Marlis and I learned some things together at the Pike Market Clinic, which was how to raise money at a grassroots level. And grassroots fundraising is the most powerful thing in the world. You know, people can do it for themselves, and sex workers are really quite good at it. They just don't know it. And they were used to getting money from the government and from Gates, and Gates was about to leave, and they needed money not for HIV prevention tools and dollars. They needed money for human rights. They needed money for becoming citizens. Sex workers, women particularly, have no legal identity without a husband or a father. They don't exist. Therefore, they can't participate in society in any benefit status at all. They can't keep their kids in school. They can't dress their children. They can't feed them. And those are the issues that, in the midst of harassment and danger from the police and from clients, are the things that are really on their mind. Sustaining their children is really what's on their mind. And so it was nothing but a situation of volunteering where you got all the value. I mean, our value in attempting to do some grassroots training on fundraising. My mother was always asking me, "Do you think you're doing any good there?" And I'm like, "Oh, Mom, no." This is a great gig. We're traveling all around. We're talking to people. We're getting to meet the most amazing people. Our lives are very different because of this experience. But I think our value and contribution was very small. The value that we got and the incredible experience that we got was totally amazing. So.
Chris, do you want to have final words or take another question?
Well, I would like to go back to the fact that you can give money tonight when you leave. I am serious, really, I am serious. We have 1%. We can cover less than 1% of tuition with the money that we have to work with now. And the challenge is incredibly big to make a different leadership future for community health. And with your help, you can be part of that, and it's a great thing to be involved in. Where are the envelopes are outside on the table. There's even a QR code that you could put on your phone. But really, I want you to think carefully about this because I want it to be meaningful. And I don't want you to just drop $5 in the basket. $5 is good, but I'd like it to be meaningful. So think about it, and I encourage you to join me.
Yeah.
Okay.
Thank you, Chris.
So I just have to say, this actually isn't a fundraiser. This is actually an evening to honor Chris, but I think those of you who know her well know that that's the kind of person she is. And I do have to say, Chris, you picked an amazing area. The 8-seed program is really an exemplary fundraising opportunity within the school. It really is reaching out to students on a need base, and something that we are very proud of and is a high priority for us. So we are very appreciative that you brought it up, and humbled by the fact that you have turned us honoring you around to asking people to help us. So thank you everyone who's here for being here for a truly special evening. Thanks so much to Amy and Jack for doing a great job of moderating. Thanks to Chris for a fun evening and also just being an incredible inspiration. We hope you've enjoyed yourselves. Please drive safely going home, and we hope to see you again.